The Assisted Living Innovation Platform is a government-funded project to address the challenges of assisting individuals with long-term conditions to stay well and independent for as long as possible. A technology proof of concept was conducted using the resources of the Microsoft Technology Center. This video shows the results of the proof of concept, demonstrating how commodity technologies such as Microsoft Health Vault and VoIP Telecom's messaging service can provide an open platform for telehealth and telecare. Felicity is 60 years old, retired, and lives at home with her husband Brian, who's 65. Brian has recently been diagnosed with the early stages of Alzheimer's disease. Felicity is the primary carer for Brian, and she also has an elderly mother, Doris, who has type 2 diabetes and chronic obstructive pulmonary disorder. Both of these conditions need constant care, and Doris is visited regularly by her community matron, Kate Clark. As Doris lives over 50 miles away, Felicity uses ALIP Anywhere Anytime services to keep in touch with Doris and to help monitor her health and stay in touch with health professionals like Kate. Felicity is at home using an ALIP service on her laptop to check on the family's activities for the day. She sees when Brian needs to take his pills, and she notes that she has a video call with Kate Clark later in the day. She checks on the house monitoring system, which shows a room plan and a status for each room. She notes the overall status and the general condition of heaters and other devices in each room of the house. Felicity keeps a check on her husband's condition through various social networking sites. She's subscribed to news feeds and support groups, and also she looks at posts on Twitter and on Facebook. This one shows some relevant information about Alzheimer's. The ALIP Anytime Anywhere services make it possible for Felicity to have some measure of independence, and she continues to enjoy her yoga whilst being able to keep in touch with Brian and her mother. But before going out, Felicity wants to make sure that Brian won't be anxious, so she writes a message just to remind him that she's at yoga. She arranges for the message to appear whilst she's out, and she makes sure that it will be shared with Brian. Felicity also wants to set the level of alerts that she wants to receive whilst she's out for both Brian and Doris. She's not overly anxious about Brian, as he has his set routine and is comfortable taking his medication. But for Doris, she raises the level of the alerts because she's been unwell recently, and she also adds a mobile number for a volunteer who lives close to Doris. So, Felicity goes out to her yoga class and Brian settles down to watch rugby. Whilst he's watching rugby, Brian sees the reminder that Felicity had set earlier in the day. This gives reassurance to Brian, as he may have already forgotten where Felicity had gone, and that would have caused him some anxiety. With the ALIP Anytime Anywhere service, alerts and reminders are set to appear on any device that is used by Brian and his carers. A few minutes later, there's another reminder for Brian to take his medication. But Brian continues to watch the rugby, ignoring the prompt to take his pills, and in a few minutes he'd completely forgotten. A little bit later, another message appears to say that his medication is now overdue. And normally, at this point, Brian would use his pill dispenser, which dispenses a pill at the appropriate time, triggered by an SMS message from the VoIP Telecom service. But he was too engrossed in his favourite game. The rugby's over, and Brian decides to go for his daily walk around the local park. Brian is wearing a watch phone that records his location in his shared record in Health Vault, so that his care community knows where he is. During Brian's absence from the house, any alerts are sent to his watch via the VoIP Telecom service. Brian receives an alert that his medication is due, but Brian doesn't have pills with him. Another alert is sent to Brian's watch. Your Exelon 3 mg capsule is overdue. Brian dismisses the reminder by pressing the OK button on the watch and walks home. Meanwhile, Felicity is at her yoga class and she decides to check on Brian via her mobile. She's able to see the status of her house, and she can also see that Brian is out and that he's not taken his medication. She's not too worried because he'd taken his pill this morning, so she continues to enjoy her class. This is the screen from an actual mobile which was produced at the Microsoft Technology Center Proof of Concept. As well as seeing the status, Felicity and other nominated carers can receive text messages for any event that is considered important. For example, Brian has finally taken his pills. Felicity has returned home after her yoga class. She has a video conference call later that afternoon with Kate, the community matron, to discuss Doris's care. Before the call begins, Felicity looks at Doris's health fault record. She's able to view her current medications, but at this stage she simply wants to record the fact that she's worried about how her mother always seems to be tired. So, using the Notes tab, she records a note which goes into Doris's health fault record and will be available to Doris's care network, including Kate. Felicity then clicks on the Measurements tab in Doris's health fault record, where she can see the results of all of the devices that Doris has been using in her home. This one shows the results from a pulse oximeter that's measuring oxygen saturation and heart rate, and this is used by Doris in her home. And this one shows the readings from a blood pressure monitor. Doris takes these readings on a daily basis using health fault connected devices that are connected by USB and by Bluetooth. Kate, the community matron, is preparing for the video call with Felicity and the care team. Kate is looking at her community patient management system and she selects Doris's record. On Doris's record is a health fault tab through which she's able to see Doris's health fault record. She opens the record, which is displayed using the standard NHS Common User Interface screens. She sees a similar view to Felicity, but with more information that is pertinent to her as a health professional. She reviews the measurements that Doris has recorded using her health fault connected devices. She looks at the saturation levels and notices the steady decline. She can also see the latest note that Felicity has added about her mother's tiredness, which is probably due to the decline in O2 saturation. It's 4 o'clock and the conference call is due. Felicity joins the conference call with Kate, Doris's GP, Dr. Dowling, and Doris's consultant, Mrs. Richards. They review the readings, and Mrs. Richards explains that the decline in O2 saturation may be because her mother is not regularly using her breathing machine. Armed with this information, Felicity is able to encourage her mother to use the machine, and her condition improves.